Dr. Joel Zinberg is a health and policy expert for the Competitive Enterprise Institute. He's authored a fabulous piece for the Dallas Morning News that says the president does not have any such authority. Dr. Zinberg is a guest on our program now. Doctor, thank you so much for joining us. Good to see you. Really enjoyed your piece as well in Dallas Morning News because it did answer a lot of questions. I mean, first off, the most important one is that no, you say the president does not have any such authority. So are they just banking on I guess probably on the process, the lengthy process it's going to take to have litigation over this and maybe make its way up to SCOTUS? Or, I mean, what is your take on this, and how long can they, in effect, push these mandates without having any legal authority to do so?
Well, so the president has very limited legal authority to require certain people, like government workers or people in the military, to be mandated. But the important thing to remember is that under our Constitution, the federal government is a government of limited enumerated powers. So while the federal government and the state and local governments share some authority over the public health, it's historically, traditionally, and via the Constitution, been largely regulated by the state and local governments. They are the ones who regulate public health, safety, and welfare under their police powers. And those are powers that are reserved to them by the Constitution. So the federal government does not have those sort of broad powers. They can only function under the powers that are listed in the Constitution. And there's nothing in there about vaccine mandates or general public health type thing. So at minimum, there's a constitutional question. And in addition, there's a question on where's the statutory authority to do this? The president can't do this on his own. He needs to have some sort of statutory authority given to him by Congress to impose these sorts of mandates. And I argue in that piece and other places that the government trying to impose a vaccine mandate on workers in private industries around the country is an overreach of authority, both constitutionally and under the statute that they relied on, which is the Occupational Safety and Health Act, otherwise known as OSHA.
And that was, of course, they raised a lot of, created a lot more questions last week when it was discovered that they had revised one of their CFRs to eliminate reporting of any adverse reactions. And even though I always say, even though it's rare, doesn't necessarily make it rare to someone else, or if it seems anecdotal, it doesn't. If it happens to you, it's not necessarily anecdotal. But that seems it seems of a struggle to say that this is about safety and health if we're eliminating reporting of any kind of reactions of any mandated injections, especially for government workers. But even so, in the private sector too, to enforce something like that. I mean, do they even have can they do that without an act of Congress? I mean, there are a lot of people asking questions.
No, so there have been two real instances of government overreach during the pandemic, where there was no real statutory authority. The first was the eviction moratorium that was promulgated by the CDC back in September of 2020. And that was renewed multiple times until finally the Supreme Court had to rule that they had gone beyond the CDC had gone beyond its authority under the Public Health Service Act to order that, because basically the types of things the Public Health Service Act listed to limit infections and limit the spread of communicable diseases were not the types of things like vaccinations. They were things like fumigation, destruction of diseased animals, quarantines, but there was nothing like vaccination. So the Supreme Court struck that down. Now, the federal government might arguably have had some authority under the Public Health Service Act to impose vaccines. It's questionable, but it's certainly better. But I think the Biden administration decided we had such a bad go with the eviction moratorium, let's look for another authority. So, in both instances, they said well before imposing these mandates that they thought they lacked authority, but they went ahead anyway. So they chose to use OSHA, and that's a very unlikely type of authority to rely on, because OSHA is meant to regulate workplace safety. And it's meant to protect against the types of hazards and substances that you encounter in a workplace, chemicals, things that are flammable, things that cause cancer. It's not really meant to protect against infectious disease. The only time they've actually imposed any sort of mandate dealing with infectious disease, they have what's called the blood-borne pathogen protections or standards, but there they don't impose a vaccine mandate. The most they do is they say that employers have to provide access to hepatitis B vaccines, not that they have to mandate that their workers take it, just that they provide free access to those vaccines. So it's really kind of doubtful that OSHA allows this sort of thing. But even worse than that is, under normal type of rulemaking in this country, we have what's called notice and comment, where the agency would publish a proposed rule. There'd be an opportunity for the public to comment. It can take several months. And then the agency is supposed to adjust that rule based on what the types of comments they receive. The president was saying to OSHA, don't do that. He decided to go with a different type of thing that's allowed under the OSHA Act, which is, and in terms of the second standard they have to meet, is the standard necessary to protect. Well, why would you want to impose an invasive procedure like a vaccine when you could have non-invasive procedures that appear to be effective? And I don't have to go very far. I need only look at the fact that in June of this year, OSHA imposed one of these ETSs on healthcare facilities, and they required the facilities to utilize a variety of non-invasive, non-pharmaceutical methods to protect their workers against transmission. So it's things like masks, physical distancing, ventilation systems, things like that. And their justification for that in the standard was that they said these are effective means of interfering with transmission.
Right.
So if you have these effective non-invasive means, why don't we use those before we resort to vaccines?